Good afternoon, I'm Sarah Birchall and this is my Inc. 5 OSCA Part B. By using Borton's reflective framework, What, So What, Now What, I was able to complete an in-depth reflection on yesterday's OSCA. The what part of the framework is talking about what went wrong. For me, an in-depth rationale for each intervention was missed. My lack of rationale for deciding to choose each intervention and prioritize them the way that I did wasn't completed. Therefore, I wasn't able to demonstrate my clinical thinking skills. The so what part of the framework talks about what would happen in a clinical situation because of my lack of rationale. This may include the patient not knowing the reasoning behind your decisions, not allowing them to have that really important informed consent. This can lead to the patient not being part of their own care or recovery, affecting their ability to understand their illness and what is required to be successful in their recovery. It also allows the patient to feel comfortable and secure whilst they're in your care. This is important when you require personal information from them, such as past family history. Lack of rationale can also influence the way the team works together. For example, someone that doesn't provide rationale to their colleagues may seem like they have dominance, influencing the way the team communicates and the way they perform tasks. Another influence could have if a colleague being given handover and the nurse doesn't provide rationale into starting a fluid balance chart, this assessment may be ceased as it doesn't seem important to that nurse. In the OSCA Part A, I didn't provide rationale for prioritizing a focused respiratory assessment over managing Alison's pain. Next time, I would talk about why I performed the respiratory assessment first, because she was pale, this being a sign of someone whose respiratory system isn't working sufficiently, and they are becoming hypoxic. Another note that is important is when giving a patient fentanyl, nurses must monitor the patient's respiratory rate, SpO2, closely, as this type of medication can slow down this system. And for someone who is already having difficulty getting in enough oxygen, this could have detrimental effects, for example, respiratory arrest. The now what is the changes I would make next time and how I could implement them. In the future OSCAs and handovers of my future nursing career, I would provide an in-depth rationale to my patients to ensure they have informed consent, allowing them to play an important role in their care, which can also increase their recovery of success. I would provide rationale to my colleagues to open up communication between the team, allowing colleagues to provide their insight and provide feedback on areas I might have missed, or I could also aid in their understanding of the case. A smart goal I could use in this situation in communicating with the patient is to why I'm completing certain assessments. This is specific as the information is specific to the patient. Measurable as I can ask the patient their understanding, a technique known as ask back. Achievable as there is tasks, as this doesn't take a lot of time or resources. You can usually talk to them about this whilst performing the task or gaining their consent before you start. It's realistic as I know I can achieve it as I've done it before in previous OSCAs, and is time specific as we can make the time over any specific time. An example could be at the end of a shift, completing this at handover and asking the patient their understanding of their disease. Thank you.